If you attended our last event with our last CEO Business Breakfast event with the German-Hungarian Chamber, you may well remember that it was completely packed out. Then we were discussing the development of the Hungarian defence industry, which clearly is important, as was obvious from the number of people that we had for that event. That was our biggest to date. But it's also slightly specialised. Today, we're going to look at something that affects each and every one of us in this room, whether personally as civilians, definitely as employers, but also potentially as business suppliers. And that's healthcare, specifically Hungarian healthcare, and specifically the health of Hungarian healthcare. I don't know if it's that good a title, but thank you anyway. As usual, we have brought together a high-level panel who will share their experience and help us explore both the healthcare and the pharma landscape, because that is important and allied to it here in Hungary. Specifically, we're going to talk about the new industrial strategy for the sector, recently outlined by the Ministry of National Economy. And we're going to help to delve into the workings of the health service and explore what opportunities there may be for foreign investors in it. So, without further ado, will you please welcome our esteemed panel, Dr Judit Bidló, Deputy State Secretary at the Ministry of Interior, responsible for healthcare. Give her a round of applause, please, ladies and gentlemen. We also have Dr Ádám Nagy, Deputy State Secretary for Industry Affairs at the Ministry for Economic Development, where he's responsible, among other things, for strategic planning. Adam. And our final panelist this morning, Tamas Radai, who's from the Association of Health Technology Suppliers and Medical Device Manufacturers. Tamas. What we're going to try and do through a series of questions is build some background knowledge, give us some basis on which to take that conversation forward, and then we're going to drill down into some details. Judit is that person that I mentioned that we've now shared 3 panels. So I'm going to start with you, Judit, if you don't mind, as we're now old friends. I think it will be useful, before we get into the detail, to frame where we are today. So what's the current actual budget for Hungarian healthcare, and where does that money come from?
Okay, thank you very much, and thank you very much for the kind invitation. It's always a pleasure to be here with these people, and it's a special occasion that we have our colleagues here. It would be a very interesting discussion, I'm pretty sure. So concerning the healthcare budget, I would say that, as I mentioned previously in a couple of times, that in Hungary there is a so-called Bismarck-type insurance system, which would indicate that the coverage of the healthcare expenditure should be related to the health-related tax. But unfortunately, it is not sufficient and not enough. So those money that I paid as a health-related tax is not enough to cover the expenditure, so there is always a need to make an additional volume from the other tax to make it eligible for the healthcare system and the operation of the healthcare system. I'm very glad that this year had the decision that the Budget Act will be planned for the next year only in November, which gives us a possibility. I think it's a very good thing, really. It's a very good opportunity, because I think this gives us a possibility that we have enough result for this year. I know that some of the companies are very sad of that, because the planning time is just before that. Usually I guess it's in the end of the summer, so maybe there will be some problem because they are not aware on the Budget Act or the planned Budget Act at that time. But I think it's a very good opportunity, because at that time we will be aware how this year's spending goes, what are the most important things we have to handle, what will really have an impact into the Hungarian budget.
Could we put a figure on what it will be?
No. On November. On the 1st of November, I will. I promise.
All right. I tried. What's the figure for this year? So what's the budget spend for 2023?
There is an interesting question mark because the healthcare spending budget is that has two major parts. One is that the benefit in kind, and the other is the benefit in money, because the healthcare budget also contains those. I cannot say in it English. I'm sorry. Maybe ask for translation. But the GES, GED, and so on. If there is anyone who knows it, so when you give the maternity fee and those when you are illness, you have some subsidy as well. And this is approximately 1,000 billion forint, and there is another 3.5 billion forint that is the benefit that we can spend on the healthcare system and the operation of the healthcare system. It contains all the hospitals, the pharmaceuticals, the medical devices, and so on, so everything. But it's 3.5 million. There is a debate on this is how much percentage of the GDP, or is it enough or not. Currently, we are spending the 6.5% of the GDP just on the healthcare, so it does not contain those that are spent on the maternity fee and other subsidies that provided in money.
Thank you very much. That's very useful. Adam, did you want to add anything to that? I saw you picked up your phone, your microphone.
Yes, just to ensure, thank you for the invitation first. This is my first time here, not in this venue, but at this occasion. This is Judith's field, of course. She knows much more about that. But just one thing to be sure, or to assure, that if the central healthcare budget is well organized and well used, then the market players will have a healthier connection to this budget, and we from the industrial side, or we from the governmental industrial side, will have easier task maybe to form our subsidy programs, which can add to the healthcare budget system's healthy welfare. So this is the connection with the industry, that we want to have the healthcare budget in very good condition, because other monies can be sent on the developments of the sectors and the companies.
Thank you, Adam. And Tamas, we might as well take the opportunity to introduce you again. Anything you'd like to add to that background?
Yes, just maybe one or two sentences. It's common sense that with the aging population and the technological development, modern healthcare costs greater sums. So governments have to allocate more and more money for healthcare. And it's a fact that in the past decade, health expenditure in Hungary have been increasing significantly. But the extra resources allocated to the healthcare system was mainly spent on the increasing salaries of healthcare professionals, which is good news, and it's inevitable and necessary. But I would like to mention that for example, within the hospital budgets, the other types of expenses would also need extra resources. I'm representing here the medical technology sector, so that's not a coincidence that this came to my mind. But this is also a very important aspect of providing healthcare.
No, absolutely. Not the current issue of the BBJ. The issue previous to that, we had an interview with the regional boss from MSD, and he said two things which were very interesting. One was that he said that he thinks Hungary should spend more on healthcare as a percentage of GDP. So perhaps we'll get to that. But he also said that it's very important to acknowledge that pot has been made bigger, particularly in terms of salaries for doctors, because he went on to make the point that, you know, you can have the finest buildings in the world, you can have the finest drugs in the world. In his particular case, if you don't have the staff to operate it, there's not much point in going forward with anything really. Let's try and contextualize where Hungary is. We've already raised the subject of GDP, and some people have different estimates as to how much is in there. According to the state of health in the EU-Hungary country health profile for 2023, which is a Eurostat publication with a really annoyingly difficult title, I have to say. According to them, spending on health in Hungary is among the lowest in the EU, and it actually puts Croatia, Slovakia, Poland, Bulgaria, and Romania as the only EU states behind it. It also makes the point that the numbers overall of doctors and nurses are below the EU average. And I'm always conscious when we do these panels that, you know, we have people from the government here, and I'm not trying to make a bat to beat you with over that. But if we are below the EU average, presumably we want to rise to the EU, at least to the EU average. So what's being done in those regards to hire more doctors and nurses and to spend more?
Okay, thank you. I've got two comments. Of course, the first one is that all around the world, it's a huge dilemma that the economic affordability and the technically possibilities are far beyond to each other. So it's always a huge dilemma what to finance and how to finance it. And then the other one, that there is a saying within the European Union, and it's pretty interesting. So all together with all the other Western European countries as well, that there is a saying that maybe there will be earlier lack of human resources than lack of money on financing the healthcare. So, and it's not just the question of the salaries, but it's also lots of things. So education and so on. Maybe in a technical development we can involve into the decision making and in the healthcare also the artificial intelligence as well. So, but I think we are not in a time now, so it's an interesting question. So that's how we would like to handle it. And the most important thing when we are talking about to allocate more money on financing the healthcare, that I'm pretty sure that it is not good if we allocate more money into this kind of healthcare system within this structure. So first we have to somehow reformulate the structure of the healthcare system now and make it more efficient than as it operates now. And we are hardly working on that. There are other aspects as well. We try to, I'm pretty sure that Ádám will touch it in the future on both part, somehow to force companies to invest here. This is one side, and on the other side, we have to really reformulate the structure of the hospital system, of the outpatient care system, and of course, what is fundamental, the primary care system, including the prevention part of the people. So when we are finalized, and that's why again I'm glad with this November planning of the budget act, that maybe that time we will have a figure how we would like to see the healthcare system itself in the couple of next years, and that will give us a possibility to allocate more money into a new system, a much more efficient system.
Thank you, Judit. Tamas, is there anything you want to add to that? Or Tamas?
Thank you very much. I think this is a very good panel. The composition of the panel is very good because when we are talking about healthcare issues, we usually tend to talk about those issues from a healthcare point of view or from an economical point of view. But these two points are linked and intertwined. Hungary has a very bad position within Europe in terms of preventable mortality, both So in avoidable mortality, which means both preventable mortality and treatable mortality. And this problem reflects on the fact that the population, the health of the population and the competitiveness of the economy is very closely linked, because premature deaths cause not only family tragedies but also a loss of human resources. I have to look into my notes because I know that State Secretary Bidló is very good at recalling facts and figures. I have a very interesting statistical fact that the number of employees working beyond retirement age, so 65 and over, has tripled over the past 10 years. So we increasingly need the workforce of the elderly. In order for them to be able to work, they have to be in a good physical shape and having good health. And another very interesting fact, a recent study from well-renowned health economists analyzed the losses that Hungary suffers from early illnesses suffered by the population. And this study points out that every year Hungary spends more than 500 billion forints, way more than 1 billion euros on sick leave and disability expenditure for people in the active age group between 30 and 64. So my bottom line is that we should and we could see healthcare expenditure as an investment into the future achievement of health policy goals as well as economic policy goals.
That's very interesting, because that means that we are relying increasingly on what the Americans would call elders, and we need to maintain their health. But at the same time, we have real issues with the youngers, with the active population. That's a little worrying. Adam, the reason I didn't go to you straight away is that I'm going to get to you with a very specific question, which really talks to your role. But before we move on to that, is there anything you wanted to add to the conversation?
Yes, just only some facts from the economical side of this question, that to reach the goals of the Hungarian competitiveness goals or development goals, we have to take care about the fact that we are reaching almost reaching the total employment, which means the employment ratio is above 75%. It can be increased, but there is not much left upwards. So maybe 80 or 85% of the employment ratio can be available in a few years' time. But we are now in the situation that we have to mobilize all the people that are capable of working, either older people or those ones who are not active or they are inactive. This is very, very, very hard task, because these sectors or these people are not working. In the meantime, whoever wants to really work and has the capabilities and he's healthy and everything, he can work in Hungary right now. So that means that we are at the ratio of total employment. So we need to have other ideas, like mobilizing these people who are inactive or older people, and this is from the economical side. We have to invest much more into those types of technologies, coordinative technologies or development technologies that can, in some cases, replace the human resources. Of course, there are sectors that are more than capable of replacing human resources. Maybe the healthcare system is not that capable. I'm thinking about all the work of the nurses and doctors. This cannot be replaced easily. But this is still a fact that there has to be some, I don't know, changes in our minds, what we are thinking of the development of the healthcare system. I mean, the infrastructural system can be much more optimized or can be much more effective, and it can help using the whole healthcare system. And another thing that we are always hearing that the main part of the doctors or nurses or the workers in the healthcare system who moved to Western European countries or other member states, because they are not paid enough in Hungary. That's one fact. But the second fact is, as far as I remember, this was one of the main purposes of joining the European Union. So it's not a question that people are leaving for better jobs if it's allowed. It was a big boom when the Austrian and German market was opened for Eastern workers as well, from Hungary as well. And this is, I think, healthy. Of course, as I am a Hungarian worker myself, I have the family here in Hungary, and I know that this is the much more important thing for me, but this is an economical issue still, that workers can be paid double salary or triple salary in Western European countries. So we have to work towards building up a more healthier salary structure to have them stay here, but it's an attribute of the European Union also. Yeah.
But thank you for making that point, because one forever hears people complaining about migration, and it doesn't matter where you are in the world. In the UK, there's a huge debate about migration, but and the UK is a separate step because we've left the EU. It has left the EU, but yes, one of the whole points of joining the EU was free movement of labour. So it's kind of like we can't really complain about it when people freely move their labour. All right, Adam, let's get down to some more specifics if we can. So specifically, your ministry has been looking at strategic planning for the healthcare. What can you tell us about that process? How we make things better, how we make things more efficient? I think from a business point of view, it doesn't matter what the system is. You can always find efficiencies. The key is to find them and make sure you use them properly. So where are we at with the strategic development of the healthcare sector?
Yes, we had a year of planning last year in 2023. We have found out some data that we have 6 key sectors in Hungary, 6 key industrial sectors, and one of them is, of course, it's inevitable, the healthcare industry, which means basically the medical industry, medicine industry, or pharma, and the medical devices sector, and of course other subsectors or upgrading sectors are also there behind. But these are the 2 main subsectors, and we had the idea to turn the game around or change the whole game of how to preparing an industrial strategy, because we first went to the companies and to the associations to make interviews, deep interviews with them, to ask the real competitors in the European Union's competitiveness, what are the pain points and what are the possible solutions, what are their recommendations at the end of the day. Now we can hear that at the European Union level on the 21st of February, some big players of the European economy have provided for a declaration. This is called Antwerp Declaration, and it means that the bigger companies, led by chemical industry companies, but others joined this Antwerp Declaration as well. More than 1,000 companies and associations now are signatories. So they are asking the European Union's leaders to ask the companies what are the problems with the competitiveness. This is the first point what they are moving for towards the European Union. In the Hungarian strategy preparation period, we started with that. We didn't want to tell from ourselves, I'm responsible for almost all the industries industrial sectors, but there is no man on earth, maybe some ministers can be, that they know all about all the sectors. This cannot happen. So we have to ask the real people, the real competitors of the European competitiveness, what's their recommendations. We have collected almost 800 recommendations in the 6 key sectors, and we have turned these recommendations into governmental decrees. It means that we had at the end 70 or 75 key recommendations, and if you have the chance to read through the governmental decrees, which is the number 1073 and 1074 this year, you can find 41 governmental decrees, which are always based, each of them is always based on 1 or 2 recommendations of the private sector. So that was the process. And in 2024, in March, the government approved or confirmed that this is the valid industrial strategy. And then Mr. Márton Nagy, the Minister for National Economy, upgraded it to a higher level, which means he calls it and he speaks about it as a competitiveness strategy on the whole, which is based on core industrial recommendations. So that was the process. And now, this year, we are working on completing all the tasks that are coming out from the governmental decrees, which is a very hard work because we have some outdoor programs like this. We are talking about the strategies. Of course, we are explaining it in the media. We are trying to explain it in the European Union level, on my level, and higher level occasions. And for the health industry sector, there are, I don't know, 5 or 6 key issues that are reflected from the recommendations into the governmental decrees that we shall work with. The medical or the medicine sector is a very, very big potential sector in Hungary with an awful lot of tradition as well. But we are coming to a turning point that the operation costs of this sector, namely the taxes and other operational costs that are costing higher than a few years ago. Now this sector is thinking about how to invest in Hungary and what opportunities they still have. This is one issue that we have to work on. So balancing the costs of investments somehow and making Hungary still available for comfortable and good investments for the FDI. The FDI system itself is an interesting question in all the sectors, but in the health sector as well, the health industry sector, because we need, as an open economy, a lot of FDI coming into Hungary. But now we have a lot of investments that are turning into fruits or turning more fruitful in the last 5 or 10 years. So we have to take care about all these foreign companies who are here, and because the second level of FDI is upgrading their development who are already here. So not only the incoming FDI is existing, but the here already located FDI has to be developed. Other issue with the medical sector is that we have to do something, and it's very much connected to the health budget and very much connected to Judit's daily work. We have to somehow deal with the pressure coming from the prices compared to the European Union level prices, thinking about the products of the medical sector. So there is some movement, and there are some recommendations from the sector as well how to deal with this issue. Turning to the other subsector, the medical devices, there is a big problem of the sector. I don't know, 6 or 7 years ago, the European Union started to talk about a new directive, MDR and IVDR directives, and there are some very heavy obligations burdening the Hungarian and European level companies, mainly the small size and medium size companies, to upgrade their informations, to upgrade their quality of the products due to these demands of the European directives. It costs a lot of money for them. It costs a lot of energy for them. And this is a question of life and death in some cases in the medical device sector. So the government, one of the governmental decrees, we declare that we shall start a new program for this subsector, which try to somehow subsidize with soft tools and with financial tools also these demands coming from the European Union directives. So just in brief, I think we have a well worked out and well underbased or underlined strategy, which means that the health industry sector is, of course, one of the key sectors, coming from the point that this is one of the main important sectors of the supply and services for the Hungarian citizens. And we see now 3, 4, 5 big issues that we have to take care about in this year, or at least start and strengthen the conversation with the sector to upgrade these subsystems with the prices of the medicines, with the possibilities of the investments, and with the development possibilities of the still strong medical device sector.
Thank you, Adam. I've been doing this job long enough to have realised that the ability of ministers to absorb knowledge and appear knowledgeable depends on the quality of their state secretaries and deputy state secretaries. So I wouldn't undermine your own input into that at all. Perhaps one of the areas that was specifically mentioned was medical devices. So Tamas, do you want to come back on that? And then I'll ask you, Judit, if you've got a follow-up comment.
Thank you, Robin. I think that it is very good that the Hungarian government acknowledges life sciences industry as a key economic sector. We as a nation have great traditions in both pharma and medtech. My point is that from a competitiveness point of view, business climate and predictability of government interventions and measures is a very important factor. Also for the life sciences industry, but I'm quite sure it's very important to other industries as well. And here, currently, our industry, the health industry, faces some problems concerning the predictability of the business environment. Robin, you mentioned that there was a pharma breakfast, so I would not go into details of the windfall taxes of pharma distributors and manufacturers. But the other very important issue from my background, the medical technology industry, is the late payments of hospitals, of public hospitals, so state-owned, state-run hospitals whose management is appointed and removed by the government, etc., etc. So it's total. They are operating under total government control. Still, everybody who reads the newspapers and is interested in healthcare knows that we have, for decades, industry players have been struggling with late payments by public hospitals. So this is not a new issue. This originates long before this government took office. So this is a structural problem. Maybe this leads us back to the low public spending on healthcare. But otherwise, this is a very sensitive situation that imposes financial uncertainty to hospital suppliers. So COVID during the COVID crisis, we learned that how important it is to maintain supply chain working smoothly. And I have to acknowledge that the government regularly makes efforts to pump extra financial resources into the hospital system in order to cope with this problem. But we as industry would suggest to find a systemic solution for late payments by hospitals. And we suggest that there should be some kind of a financial intermediary institution, a bank, a state-appointed bank, or a similar organization, which takes the task of providing liquidity to under-financed hospitals from the hands of the hospital suppliers. And this way, this solution could provide predictability for the industry. So this would be a very big relief for the hospital supplier sector.
Are you already talking to the government about
yes,
that?
we have ongoing discussions, and we strongly hope that this solution will be manageable.
Okay, Judit, we seem to have, I was going to say strayed, but since this is the whole conversation, we haven't strayed. We've come back to your general area of knowledge. Is there anything that you want to comment on from either what your colleague said or Tamas has raised there?
Yes, just a couple of small comments. That the first one is that I'm pretty sure that we could commit all of you that you have a representative in the government. So we have sometimes debates with Ádám, but I think it's a very fruitful discussion always, because they always represent the industry's interests. So and I think it's very important to know, and I think it was a real proof of that, and it's really important. Concerning the hospital debt, I just would like to reflect on a couple of remarks that again, as I mentioned, concerning the total healthcare budget, it is very important to know if you allocate money for a certain area, it will be spent efficiently. As of today, because everybody, of course, I know that it is from the company side, it's obvious, but until that time, when everyone asks for really manage the debt of the hospital and make money and give money to the hospitals itself, it creates results that from the beginning of a certain year, all hospitals will not pay anything for those who they can manage it. Of course, they will pay for salary, but they will not pay to the companies, and it creates a circle which we have to stop somehow. So we would like to rather focus on to prevent the debt of the hospitals rather than how we can solve the issue that we always cover all the expenditures that has been done in the hospital, regardless the fact whether if it was efficiently spent or rather say legally spent, because sometimes it's always a question mark, but yeah, still. So it's a huge question, and again, we would like to focus on preventing the debt, and somehow there is starting a procedure when we recalculate all the financing methods of the hospitals. We recalculate all the money that is necessarily for a hospital treatment and for an operation and some other costs, and maybe this can be a result that theoretically a hospital will be able to operate financially efficiently. But this is the first step, and after that we have to solve the problem how to manage the deficit in the hospitals. But of course, I know that the companies are forced to provide all the medtech things and all the pharma, all the medicines to the hospitals. So it's a difficult question for asking more patient on that. But believe me, it is very important to somehow again restructure first and think over first, define the problems really, and after that give the solution.
So similar to what Adam was saying, you take this revolutionary approach of asking industry what it would like the industry to look like. Rather than manage the problem, we try and fix the problem. I think that's probably the key thing there. Time flies, ladies and gentlemen. We do try to open up to questions from the floor. Do not worry if you have no more questions. I always have lots of questions. But is there anything? Barbara, would you like to ask something?
I would thank you very much for the input. My question is, what is the timeline for the revolutionary reform? Because I know the companies have been working on this issue for quite a while, and I think it's a lot to ask them to wait some more. This is why I would like to know what kind of timeline you have in mind.
At least the directions and the frame we would like to finalize until November when the budget will plan.
Thank you.
Anyone else? Any questions from the floor? Gentleman, midway back.
Laszlo, Johnson & Johnson MedTech. I'm very happy that I do not have to ask the usual questions, and Tamas already asked about the debt, so even it has to be mentioned that we see some positive development, and I just wish for all of us that it continues, and really looking forward for the results of this consolidation. So what I would like to ask right now is not the debt, but how is government thinking about cooperation with companies in referring to what Tamas told, the preventable and avoidable diseases? If we are talking about cardiovascular, if we are talking about colorectal, for instance, there might be possibilities for cooperation. Even in the screening program, we are having ongoing discussion with the Public Health Institute. And earlier on, once I asked Peter Takács, just very, I would say unofficially, just as more like a chat, if you are okay with that or not. And I just would like to ask, like a confirmation, how do you feel with this kind of approach and with the possible cooperation? No business, only pure, let's say, common sense and public interest.
Yeah, thank you for not touching the debt again. first of all.
We will see when we get
with
the consolidation.
Yes. So for the cooperation, of course, I think it was the most important major step that during our presidency, which starts within weeks, let's say as the 1st of July, we highlighted and we have a decision to get it as the first and most important healthcare priorities, the cardiovascular diseases, and make a common understanding within the European Union that the cardiovascular diseases is extremely important as a whole. So from the primary prevention until the treatment and rehabilitation as well. So through the whole path, it is very important to handle. And within that, of course, the diagnosis, the screening, and the primary prevention always gave a focus. I think there is a possibilities for industry cooperation, but we have to be very careful on that, because I think we have to guarantee to everyone that they healthcare data and all the privacy are 100% accepted and not touching. So always this is a huge question mark when we are talking about the cooperation with the industry, how we can manage it. But as the industry has a huge experience on thousands of best practices through around the world, we are always happy to discussing and learn from that what we we can implement if we would like a successful prevention program or primary care program. So of course there is a possibility for a cooperation, but we have to really sign the details and make everybody sure that their data is 100% safe.
I also know that you have done some very successful screening programs with, for example, Novartis. Other pharma companies are available, so that there is already that sort of network for cooperation.
Yes, we have a lot of cooperation, but it's in the past it always linked to a certain treatment possibility. So, for example, for this kind of cooperation, we're focusing on rare disease, and this was a special screening via new generation sequencing, which is a totally new field. So I think the next step is to separate it from a certain treatment and make cooperation in a more general way.
Adam, did you want to step in there?
No, thank you.
Okay, that's absolutely fine. Tamas, do you
May
want
I
to...
have a question to Adam?
Oh, of course.
Sorry, guys. Just very sorry. One more question and reaction to that, if possible.
Follow-up question. Okay.
So, if we are talking about, for instance, colorectal, the colorectal screening program is starting right now, just very recently. If I'm not talking about pharma and data privacy, maybe that's an easier way to get involved into that if we have experience and knowledge to share. Is that right or not really?
Concerning this specific issue, it's an extremely complex. I think we will have a possibility to discuss it in a more detailed way. It's maybe not this kind of circus, but of course theoretically there is a possibility.
Thank you very much.
I believe, Tamas, you wanted to ask a question.
Yes, Robin, you're right. This might be also interesting to other people in the room. So this competitiveness strategy concerning health industry has a point that somehow the health products that are bought by Hungarian hospitals, so the ratio of Hungarian products should be increased. And some kind of a soft protectionism should be applied. I think I read this exact wording, soft protectionism. What does this mean? How can this protectionism be imagined in the practice?
It's a procedural question according to public procurement issues. Of course, public procurement is very well based on European directives and European regulation, but we still see that in some of the European Union's countries, much higher level of their national products are included in the public procurement system as a winner of the tenders, or at least contenders at the tenders. So we have to find out together with all the regulation, or with the Ministry for Justice, for example, Ministry of European Union, how we can act towards these numbers. Nowadays, the ratio is under 15%, I think, and we have the purpose of upgrading this ratio above 20%, maybe to reach 30%. It will be still the half, for example, of the Danish and French public procurement systems ratio for the nationals. There are two ways what we are trying to clear out and trying to go through. One of them is the so-called green public procurement, which is now very much into the minds, or very much into the thinking of national governments. It means that the green, the industry shall provide for, of course, more green products, but there is an attribute, the way of transportation, or the closeness of the products towards the place of usage or location of usage. So we can operate with them that in public procurement procedures, we use the phrase or make extra points or give extra points towards those products that are coming from closer directions. It means that it can be Hungarian or at least regional stuff which is coming. Of course, taking care about the quality of the products. It doesn't have to mean that poorer quality products coming from, I don't know, this neighboring building, they are better than some products coming from Germany or Switzerland. So this can be kept very carefully or used very carefully. The other issue that we can try is to think over each public procurement procedure before the opening of the tender or before the starting of the tender. There are some tenders that are using or that are gaining or demanding collective stuff, collective of products. Maybe if we can separate some public procurement procedures to one of the products, that can be useful for Hungarian competitors as well. We have done it in other sectors, partly successfully. For example, in the autobus sector, now we have Hungarian intruders or invaders in the system compared to the 5 or 10 years ago's situation where there were only German and Swedish autobus companies providing for the buses itself, not talking about the services. So it can be reached at European Union level, in the regulation level, that somehow first you can separate some procurement procedures. The second is to add this green factor or this closeness factor to the procurement procedure. Just emphasizing again that for competitors, not poorer quality companies, of course.
Judith?
Yeah, can I add two things? One is very important that this phrase and this intention of the government is not just because of making a preference for the Hungarian, for the domestic industry as well, but also, as it has been mentioned in the after the COVID, we have to find some solution to guarantee a safe and sustainable supply chain for all the providers. And it means that, of course, if there is a domestic production, so we would like to somehow really make more, forcing more domestic production. It's much more safer rather than if we have to buy something from abroad, especially from if it comes from Asia. And so that's also a very important thing. So not just forcing that. Of course, we would like somehow to help the domestic companies. And please, if you have any kind of production, regardless of the fact whether you are originally Hungarian company or not, of course, you are very welcome. And the other thing, it is very difficult to implement into the tender system, into the procurement system, because on the other hand, because of the EU regulation and another thing, we are forced, and there is again a governmental decision published in the Gazette that we have to decrease the level of those tenders when there is only one company applying for the tender. So because there is a certain ratio, and compare it to the European Union level, it's higher a little bit. So we are forced to decrease the level of these kind of tenders. So we always have to balance it a little bit, how we mentioned, but that's why Ádám mentioned it, that all the Western European countries started to focus on the supply chain and to make a domestic supply chain if it is possible.
And I suppose the benefit of using a domestic supplier is it reduces carbon footprint. So that becomes your green argument. Yeah. Did you want to come back?
Just one small comment. I think this green aspect is very important, and the physical location of the manufacturing site. I wouldn't be in the place of the Chinese and Indian manufacturers. It's very good news.
Any more questions from? Oh yes, there's a lady right there at the back. Stand up, madam. Oh, you have the microphone. Okay.
Yeah, I do have the micro. Thank you. I would have a couple of questions, if I may, to the panelists. First of all, Thank you for touching upon the industry strategy, which included also the need for a sort of a cooperation mechanism in terms of how to discuss actual details with the industry. When can we expect on the side of the pharma industry to have such a forum to start this kind of cooperation in a manner where all the pharma industry is set at one table? That would be the first question, and I would have a couple more. In June. Okay, thank you very much. Another question, if I may.
I like short answers, thank you.
Concerning prevention, it was touched upon our colleague from Johnson & Johnson, and I think it's very important. We have been hearing that the government has prepared the strategy for prevention, but we have been hearing it for quite a while, yet I haven't really seen any sort of action plan on what you would like to do in terms of prevention, while seeing all the data that was referred to and mentioned concerning the Hungarian healthcare status. We all know that this is basically the backbone of any sort of long-term strategy. So when can we know any sort of action plan on what the government is planning in terms
easy
of
to
prevention?
answer because I would like to join Adam in June. Okay.
Very good, very
really,
much.
it will be published in June. There is a finalization by the government, by the higher level of the government. It will be published in June.
I hope that the third question would be answered June as well. The third question of mine would be concerning the reimbursement. We've been talking about this with Judit quite a while, so I wouldn't ask for yearly reimbursement because I already know your answer concerning that, but just a question whether do you expect any sort of reimbursement round this year or at least at the end of this year? So can the industry count upon a government decision to have new drugs included in the reimbursement system?
As it has been mentioned, we are planning it to do it annually, and this year it has been published in January. So for this year, we are already done it, and we are focusing and try to manage an annually based reimbursement update and updating of the reimbursement list. So we can expect it in the early next year.
Okay, perfect. Thank you. And the last question of mine would be concerning the named patient program, which is quite high on the agenda of the pharma companies as the industry, because in terms or in lack of new reimbursement possibilities, of course, early access can be ensured by named patient program. I know that you also have your opinion on that, and we as industry as well, but the reality is that this is how it works. We know that there are certain changes, and we also know that for the year 2023, the named patient program budget was very high above the planned, and I suppose that it wouldn't really change structurally for this year as well. Do you plan to have any sort of mitigation in this sense, or what can the industry expect in this term?
Again, the same. It is very interesting how rumor can spread within the companies that how we will handle it. Of course, there is now a discussion how we can reformulate the named patient-based program already, and focusing that mainly for the rare disease patient, because that's an extremely important thing. We always mention that we have the highest price product as Zolgensma, maybe, but nowadays there is a much more expensive one. It's nearly double the cost of as it's Zolgensma, which so it's extremely, so we have to somehow handle it, because if there is a new medication coming into the field that costs 1 billion Hungarian forint per patient per year, it's really, we have to, 1 billion forint, so Per patient. Yeah, so somehow we have to find a solution for that, and there is a discussion on that, how we can reformulate the decision making and the financing and so on. But we are not, unfortunately, because I am for that, but we are not planning somehow to stop the named patient-based program at this time.
Thank you so much, and I would like to reaffirm that we are here. If you need any sort of input, we would be very happy to support the government and these endeavors. Thank you so much.
Thank you. Ladies and gentlemen, I think we're going to have to draw a line under it there because time is flying, which I guess means that I should attempt a summary, which is always interesting when it's such a broad subject. I think we can agree, because you would have to agree this wherever you were in the world, that financing healthcare is one of the biggest conundrums that any government has to take. It's seemingly a black hole. You throw money at it, and then you find out that money's gone, and you have to throw more money at it, and that's a circle which very quickly can become a vicious circle. So we have heard today that there's going to be an attempt to rationalize the system, to look again at the system, to ask for input from industry as to what they want, to try and fix the problem rather than manage the problem. I would say in passing, good luck to the government, because that's a tricky challenge, but it benefits all of us, obviously, if the health system is one that functions. We've talked about, well, we didn't actually talk about demographics, except that the working population is getting older, and that we therefore have the challenge of keeping them active, which is not cheap, and then that builds into that whole black hole problem again, while simultaneously dealing with a worrying concern about the health of the active population. And again, none of that's cheap to deal with. So I think, oh, and also we learned that June will be a very busy and important date. So I think we'll probably leave it there. Except, Barbara, that if we're getting to the stage where November we'll have a better idea of the budget, maybe we ought to do this again in November when we can talk about actual figures for the next year. And work out where we are with that process of meeting with other investors, with other companies, and see how that whole plan. Just a suggestion that maybe that this is a subject that is worth coming back to, because it's important personally to all of us. It's also important to our workforce. It's also important to our companies, and the level of interest in the questions demonstrates that it's also important to German-Hungarian Chamber members. So I think we'll leave it there, ladies and gentlemen, other than for me to thank our panel once again for sharing their expertise. Next to me, Dr. Judit Bidló, Deputy State Secretary at the Ministry of the Interior, Dr. Ádám Nagy, Deputy State Secretary were in charge of all sorts of things, but at the Ministry for Economic Development, and Tamas Radai from the Association of Health Technology Suppliers and Medical Device Manufacturers. And of course, if we're going to thank them, we should also thank once again the Anantara for providing this venue for us. Ladies and gentlemen, please thank your panel.